Welcome to the Silica Exposure Training for the cut stone industry. This training covers the identification, evaluation, and control of silica exposures in cut stone and stone fabrication industries. The training was developed by Georgia Tech's Safety, Health, and Environmental Services Group with funding from the U.S. Department of Labor's Susan Harwood Training Grant Program. This is Lesson 7, Medical Surveillance and When to Report Health Effects. As covered in Lesson 3, respirable crystalline silica exposure can lead to the following adverse health effects: lung effects including silicosis, lung cancer, pulmonary tuberculosis and chronic obstructive pulmonary disease, kidney disease, and a variety of autoimmune diseases including lupus, rheumatoid arthritis, and scleroderma. The image on the left shows silicosis nodules, and the image on the right is a case of complicated silicosis. OSHA mandates that employees must be enrolled in a medical surveillance program when they are exposed to silica above the action level for 30 days or more a year. Medical surveillance is the key for early identification of different exposure-related health effects. This early identification has two key purposes. If employees have information about their health, they themselves can take steps to protect themselves and make different employment decisions, or decrease their risk of progression or exacerbation of the disease. And if the employer has the early info, they can make changes to the workplace to reduce or eliminate exposure. Dr. Robert Cohen is quoted as saying, "These diseases are not relics of the past. We see patients who are coming from foundries, coming in from stone cutting operations, from little construction jobs and sites with silicosis." Employers must make medical surveillance available at no cost to the employee and at a reasonable time and place, including cost of travel and time spent taking the medical exams. For each employee who will be occupationally exposed to respirable crystalline silica at or above the action level for 30 days or more per year, the employer must make sure that all medical examinations and procedures are performed by a physician or other licensed healthcare professional. The employer must make available an initial baseline medical exam within 30 days after initial assignment, unless the employee has received a medical examination within the last 3 years. The employer then must provide periodic medical examinations every 3 years that include the medical work history, physical exam, chest X-ray, and pulmonary function tests. And they can be done more frequently if recommended by the physician or licensed healthcare provider. The medical examination includes the following parts: a medical and work history with emphasis on past, present, and anticipated exposures to respirable crystalline silica, dust, or other agents that might affect the respiratory system, any history of respiratory system dysfunction, including signs and symptoms of respiratory disease, such as shortness of breath, cough, and wheezing, a history of tuberculosis, and smoking status and history, a physical exam with emphasis on the respiratory system, a chest X-ray interpreted and classified by a NIOSH-certified B reader, and a pulmonary function test, and finally, a tuberculosis test. So let's go into a little more detail for what to expect during the exam. Typically, the tuberculosis test or TB test is done only during the initial exam. Remember how in Lesson 3 we discussed how the risk for TB increases if you are also exposed to silica. The American Thoracic Society recommends that if you have been diagnosed with silicosis or have been exposed for 25 plus years, you should be tested annually for TB. For the pulmonary function test, there are two parts of the test: the forced vital capacity and the forced expiratory volume. This test is administered by a spirometry technician. Other additional tests can be performed on a case-by-case basis depending on the signs and symptoms and clinical judgment. The chest X-ray portion of the exam is necessary to diagnose silicosis, monitor the progression of silicosis, and identify associated conditions such as TB. A chest X-ray should be interpreted and classified according to a NIOSH-certified B reader. Depending on how the X-ray looks, the employee may receive a recommendation or referral to see a board-certified specialist in pulmonary disease or occupational medicine. Under the respirable crystalline silica standard, the physician or licensed healthcare provider may determine it is necessary to order additional tests. This decision can be made on a case-by-case basis depending on individual signs and symptoms and clinical judgment. For example, if an employee reports a history of abnormal kidney function tests, the doctor may want to order a baseline renal function test. Or they may order annual TB testing for silica-exposed employees who are at high risk of developing active TB infections. Additional tests that physicians or licensed healthcare providers may order based on findings of medical examinations include, but are not limited to, a chest computerized tomography or CT scan for the lung, or COPD, testing for immunologic diseases, and cardiac testing for pulmonary-related heart disease. Current research also recommends that individuals working with engineered stone be offered a CT in addition to the required chest X-ray. Once medical surveillance examination has been completed, the employer must ensure that the physician or licensed healthcare provider explains to the employee the results of the medical examination and provides the employee with a written medical report within 30 days of the examination. The written medical report must contain a statement indicating the results of the medical exam, including any medical conditions that would place the employee at increased risk of material impairment to health from exposure to respirable crystalline silica, or any medical conditions that require further evaluation or treatment. In addition, the physician or licensed healthcare provider's medical written report must include any recommendation of limitations of the employee's use of respirators, any recommended limitations on the employee's exposure to respirable crystalline silica. The physician or licensed healthcare provider should also make any referrals to a specialist if necessary. Employers must also receive a medical opinion from the physician or licensed healthcare provider within 30 days of the employee's medical evaluation. This report should include the date of the exam, a statement that the examination met the requirements of the standard, any recommended limitations on the employee's use of respirators, any recommended limitations on the employee's exposure to respirable crystalline silica, or a statement that the employee should be examined by a specialist if needed. Thank you for watching Lesson 7 of the Silica Exposure Training for the Cut Stone Industry, a training on the identification, evaluation, and control of silica exposure in the cut stone and stone fabrication industries. This material was produced under grant number SH37200 SH1 from the Occupational Safety and Health Administration, U.S. Department of Labor. It does not necessarily reflect the views or policies of the U.S. Department of Labor, nor does the mention of trade names, commercial products, or organizations imply endorsement by the U.S. government.